Good day, ma'am. I'm Marian S. Lumutak, and today I will be performing a return demonstration about administering intradermal injection. So first is for skin testing, I'm going to withdraw a 0.9 ml of distilled water, and I'm also going to withdraw 0.1 cc of medication. So that is for the skin testing. So now let us proceed to the procedure. So first is I'm going to wash my hands or disinfect my hands to prevent contamination. And next is I'm going to access the medication record of the patient and check for her name, for the dosage, the route, and the timing of the medication to be given to the patient. Okay. Then after that is I'm going to obtain or access the medication and check the label before lifting it up. We're going to check the label for um, the to make sure that we are having the same medication from the medication record. I'm going to compare it, and then next is I'm going to, after confirming it, we're now going to calculate the dosage. So after calculating the dosage, we're now going to prepare this for the getting the medication out from the vial. So we're now going to get the syringe. So in this return demonstration, I am going to get 0.5 ml of medication. Okay, then I'm going to remove, making sure that the only part that's touched by the needle is the inside part to prevent contamination. So I'm going to, okay, inject the air and get 0.5, making sure that we are getting the exact medication or dosage. Make sure that there are no air bubbles. And next is I'm going to, before lifting or withdrawing it, we're going to check the medication for the accuracy. And then next is I'm going to cover it with one hand scoop method to prevent injuration. And then the medication is now ready. So we will now going to place it in the tray, and then I'm going to place it inside the tray together with the cotton balls with the antiseptic solution to clean the area and after the procedure. Then with the medication record or medication card. And then next is I'm going to, so assuming that we are already now in the patient's room. So I will identify the client and I'm going to introduce myself, and I will be explaining what I will do to her or for the procedure. And so let's begin. So good morning, I'm Marian S. Lumutak and I will be your nurse for today. Can you tell your name for me please and your date of birth? Okay, great, thank you. And today I will be administering you medication intradermally. Is it okay to you? Okay, good. So next is I'm going to choose the site, but I have here a model and a model for skin, or yes, skin. So this part will be the dermis, the superficial part, and the yellow part will be the subcutaneous, and the red part will be the muscle. Okay. So next is I'm going to expose the area. So Mrs. Cruz, can you expose the area for me please? It is for the easy access and I will do it for you. Okay. And making sure that we are having an adequate lighting or a good lighting. And then next is I'm going to don on gloves. Okay, so assuming that I am already wearing the gloves, and then I will position the patient. I will help the patient to position her appropriately. Okay, then next is I'm going to clean the site using a cotton ball with an antiseptic solution. So, okay, in a circular motion. Okay, and then we're going to discard this to prevent cross-contamination. And then we will now going to put a cotton ball between the third finger and the fourth finger. Okay, then next is I'm going to get this syringe and remove the cap, making sure that the only part that's touched by the needle is the inside part to prevent contamination. So we're now going to inject.
Insert the needle into the skin just until the bevel is no longer visible. Transfer your dominant hand to the barrel of the syringe and transfer your dominant hand to the plunger. Inject the medication by pushing the plunger into the barrel with slow, even pressure. For an intradermal medication, you will aim for a small wheal or blister to appear. The presence of wheal or blister is an indication that the medication is already in the dermis.
So after releasing the needle, we're going to recap it using a one-hand scoop method to prevent injuration. And then we're going to dispose this to the sharp container to again prevent injuration. And then we will not massage this or the area, especially when we are administering heparin, as it can lead to the development of hematoma. And then we will going to, or for skin testing, we're going to mark the area, black marker to, or for us to know that it is the area where the skin testing was made. And then we're going to label it the time for administration. So next is I'm going to observe for any adverse reactions or any untoward outcomes, and usually 30 minutes after the administration. And then next is I'm going to leave the patient in a comfortable position. Okay, and then next is I'm going to disinfect my hands. I will disinfect my hands to wash my hands to prevent contamination. And then we're going to document the procedure done for baseline data, and of course I'm going to observe for any adverse reactions or any untoward outcomes from the procedure. And if there are any untoward outcomes or adverse reactions that is occurring, then I am going to notify the physician. And that's it for this procedure. Thank you.